Hi, I'm Eric Westrich, and you're watching Startup Show San Diego, a startup TV show about startup companies. Once again, we're at San Diego Startup Week, and we're at Startup HQ, which is Wework Co-work. And I'm here with Jacques Stroud, founder and CEO of Docfully. Jacques, welcome.
Nice to meet you.
So, why did you start Docfully? Tell me a little bit about yourself and what caused you to want to create a company.
Well, I first moved to San Diego about 2 years ago, and I had a job as a certified nurse assistant, and I took care of a young man with extreme cerebral palsy. It was incredibly difficult to actually get him to the doctor's office every month. So I felt that there was a need for him to get better health care in his home instead of traveling all the way across town just to get him to see a doctor visit. And that's the one thing that I felt compassionate to try to make a change in his life, just starting with him alone. But even before that, it started when I was in Chicago. I noticed that a lot of the elderly and disabled had a really tough time accessing health care. They had health insurance and they were able to get to a hospital or a doctor's clinics by some means of transportation, either a friend or calling emergency services, but they had a really tough time accessing health care in their home. And I felt I needed to do something to try to make an impact for that community to have an easier time to get health care.
So Jacques, what did you decide to do about it?
Well, first I started to try to take care of people in their homes. Just me, myself, going to people's houses and just say, hey, is anything that we can try to help you with to help you manage your diabetes, manage your high blood pressure, manage your, if you had a stroke, any type of information that I can give you. So I was going to different people in their homes and seeing if I can create impact there. From that point, I noticed that there was a great need for people to get access to more healthcare services in their home instead of traveling out. And so from there, that's when I came up with the idea and just tried to expand out even further.
So how do they do that?
Well, through technology. Right now, we're using telemedicine as a means to do that. That's basically video conferencing through your laptop or through a mobile app to actually access a doctor, a nurse practitioner, or a physician assistant in their office while you're at home.
So essentially preventing the need for them to even go to the doctor all the time.
Correct. So the doctor actually comes to them in their home using this technology. And we're trying to develop that whole system so that they will be able to get more information. Their vital signs will be able to be taken, and they can see a doctor or nurse or physician assistant without having to schedule time, going back and forth to the hospital, going back and forth to the emergency room, because they have scheduled visits over a couple of months to actually monitor their progress.
And what's been your biggest challenge in doing that when you talk to people or when you bring it in? What's your biggest challenge? Where do you spend most of your time focusing?
Trying to get people to believe in the technology. It's hard for someone because they've been seeing the doctor for 30, 40, 50 years that this little device will be just as good as seeing a doctor face to face. You will have the same experience using a laptop or computer to get all your questions answered than having to actually go to a doctor or have a doctor come see you to get an evaluation. Through technology and through a lot of different things that we can give to that person, the experience will be the same. They won't have to worry about trying to struggle off a couch or a chair to actually get up, get in the car, and travel across town, because that can be very difficult and painful. This way, they can stay in their homes, comfortable, feel safe, feel secure, and actually still get taken care of.
So where is Docfully now? Do you have a prototype? Are people using it? Where are you?
We do have a prototype, and we're working on increasing developing even more. Right, we're in Southern California now, and I have developers, and we're working on making it more scalable at this time.
So Jacques, what makes you think that you're on the right track?
Well, let me tell you about my first client that I ever had, a woman in Inglewood, California. I would travel to see her every 2 weeks to just take her vital signs and have her use the system. We made progress. She had a blood sugar of 400, like 480. In 8 months' time, we got it under 200. She was compliant on all the medications. We found alternative ways for her to eat more healthy. She started exercising more, and we actually found a doctor that would listen to her and help her with her medications.
Fantastic. So what does the next year look for us? When I interview you next year, what are you going to be able to tell me?
Well, we want to take our prototype and make it more operational by the end of this year. We want to at least get 10 customers also by the end of this year, small companies, small clinics, nursing homes, assisted living facilities, or senior care facilities, and then possibly take it nationwide by the 2018.
So, operational prototype, 10 new customers, and starting to get into clinics and the businesses, not just the individuals.
Correct.
Great, Jacques, thank you for what you do.
Thank you very much.
Thank you for being here, and thank you for watching.